Somatic experiencing, also known as SE, is another very powerful tool that can be used for pain and stress reduction. You've already had some experience with SE because titration is an SE tool. And the fight, flight, freeze information that you've been learning is something that somatic experiencing works a lot with. Somatic experiencing was developed by Dr. Peter Levine. SE draws upon scientific research of the mobilization of the autonomic nervous system in response to threat. In other words, the fight, flight, freeze that you have been learning about. It utilizes focused awareness of bodily sensations to engage innate self-regulation and healing. It accesses the body's ability to heal and resolve the effects of trauma, and supports you to return to comfortable body sensations after having a stressful experience. SE was originally developed and studied to help people recover from the effects of trauma, either past or recent trauma. As Dr. Levine continued on, he recognized that pain is an ongoing trauma, and SE can be very powerful to also deal with pain. And more recently, he and Dr. Maggie Phillips joined together, and there is a program that you have access to in your references and resources that they did together, specifically using SE for pain management. You're just getting a little taste of it in this program, and if you're very interested in it, I would encourage you to find an SE, or Somatic Experiencing, practitioner. It's a very gentle, effective, and safe therapy, and it can be used to reduce or alleviate chronic physical pain and reoccurring tension. SE can help build greater inner resiliency, self-regulation, and wellness, transforming negative, abusive, and overwhelming experiences and helping you become more present and engaged in life. And it can help you increase your resiliency to future stressors. So part of the increasing your tolerance to discomfort so that you can notice it and not react to it comes from the world of somatic experiencing. So I had spoken about psychoneuroimmunology previously, and the next couple of slides will be exploring it a little bit more. Because this is such a long word, it has been shortened to PNI. And PNI can also, for our purposes, be looked at as help is on the way. Psychoneuroimmunology was developed by Dr. Robert Adler in the 1970s. It is a multidisciplinary field, and it is a field of study, and we will be looking at the practical application of it. But the study draws together fields of immunology, psychology, immunophysiology, neurobiology, endocrinology, and psychopharmacology. Wow, a lot of big words. And this is all our body. And PNI brings together these different fields to explore their interactions in our body. We only have one body. And all these fields look at different ways that our body functions. It can be a very safe and effective approach to healing. Now, the practical application of PNI is something that we'll be looking into, and you're welcome. You have some resources and references for this, and you're welcome to go further. In terms of practical application for PNI, there was a lot of research originally done with children who are undergoing different medical procedures, children with cancer, children with pretty difficult diseases that required a tremendous amount of surgeries and other medical interventions. And because children are so open to trying new things and they're so willing to use their imagination, they began experimenting and discovering that by pairing a medication with an image, a medication with a deep breathing, that very quickly they could take away the medication or significantly decrease the medication and just leave that image or that tool. So that's how we're going to be looking at PNI. And because of this, it's continued to be researched then with adults. It offers the possibility of successfully treating difficulties that have not responded to medical interventions. It has been used to increase the effectiveness of pain medication and decrease the need for pain medication. And as always, as you're experimenting with PNI, and I'm going to encourage you to be as open as children, always consult with your doctor before making any changes in your medication. If you're finding that this is a very useful tool for you and your tendency is to decrease your pain medications, make sure that your doctor is aware of this.